Hi everyone, my name's Michelle. Thanks for clicking on this. If you've clicked on this, you are probably in the same boat as I was months ago, actually probably years ago. Let me start out by saying that I've had back pain for years. I'd like to think that it started when I was maybe 16 years old and was in a car accident with my family, and my back got tweaked back then. And it's been something that I've lived with for the next 30 years or more. There would be times when my back felt great and I could do all sorts of things, all the regular things. And there were times when one extra step just took everything out of me and I couldn't do anything else for the rest of the day, or my back would go out for a week at a time. So it's really been something that has been with me for a very, very long time. Earlier this year, told my husband, I said, I need to get this checked because something just doesn't feel right. My back hurts all the time. We had gone through this last year when my husband had surgery on his neck and spine pretty suddenly. It came up to him and took him down, and we saw a doctor who said that he needed to have surgery. So earlier this year, I thought, okay, let me find a doctor who could check it out and make sure that I'm just not losing my mind, because again, people talk about back pain as if it's just the norm. Everybody has back pain. When you Google it, when you look it up, it pretty much comes up that back pain's probably one of the top reasons that people go to the doctor, or that people are missing work, or people aren't feeling well because of back pain. It was so common. And that was pretty much what I believed for years myself. Whenever my back was hurting, I'd take Advil, Aleve, or Tylenol, and it just got to be that was part of my norm. I always felt the back pain. It was kind of a low level 2, maybe creeping up to a 3. It was just something that was always there. So anyway, like I said earlier this year, I thought, let me just go to the doctor and see if I can find someone who could get some help. So we checked on my insurance, and I ended up going to see a doctor and explained this very thing to him. And he said, okay, well, let's get some x-rays, which I'd had x-rays 5 years before, and we got an MRI scheduled. Throughout all of this time, again, I've been feeling this sort of pain for quite some time. So I've been to chiropractors, I've had acupuncture, I've had heat therapy and cold therapy, and most of the time it would help for just a little bit, and then it was right back in there. So years ago, I was told, well, yeah, you have a degenerative disc. That's really hard to say. And so I knew that. Okay, great, I get it. I've been told that, and told that it's just kind of always going to be there. And lots of doctors said, well, if you lose a few pounds and you stretch and you work out and you build those core muscles up, you'll feel much better. And trust me, I tried it all and did it all. And unfortunately, the more I did, the more it hurt. The less I did, the more it hurt. It was just kind of a vicious cycle. So I went on the doctor's orders and got my x-ray and did the MRI. And if you've never had an MRI, it's kind of like going into this bubble chamber, and they don't really strap you in. You just lay on the table and it goes in, and there's a humming drum sound. And I found myself out as I was laying there kind of thinking of beats that I could make up to this humming sound. So it was kind of funny because when I came out, I told the technician who had done it, I think I got a good beat in my head that's based on the MRI machine. Anyway, got those done, had an appointment back with the doctor, and he looked at it and said, yeah, we've got an issue here. Again, I already knew that I had a degenerative disc, but from there he saw a few more things that kind of turned the corner for me. Lumbar spinal stenosis was the first diagnosis that he said. A herniated disc, radiculitis, and degenerative disc disease. Let me explain the process of what the doctors actually have to do. So this is a gross out factor, so if you're a little squeamish, you might not want to hear this part. But basically, they go in from 2 different points. I have 2 inch scars on my back and that are bandaged right now from where they go in. But basically they go in, they work with the degenerative disc that's in the space, and they drill those out and clean that all out. I had a cyst in there that they had to take out and clean out, and then they put brackets inside and they fill it with whatever it is. I don't know all of the process, but they fill it and your bone grows and heals around that. And so basically they've set up 2 brackets with screws on my spine to get them back into place where it had slipped, cleared everything out, put some of the spacers in there, and so the bone will grow around that and heal. So that's why I have a recovery time of 4 to 6 weeks, because it deals with bones. If any of you have ever had a broken bone and you were in a cast for sometimes, that's what it's like. And so again, that's why I'm wearing this back brace. And so the brace supports my back and makes sure that those brackets can heal and the bone will grow around them so that it will be fine and strong. The doctor says I have good bones and they're strong and healthy, but it was just that point of where they shifted. So if you imagine like putting your fist together, if this was your spine and having part of it kind of move forward or move back, and not having that, I don't know, that jelly stuff that's right in the middle, that's what they fixed for me. And so I'm hoping that will make it better. Where that had slipped out of space, that's where I was getting the cyst. That's where it was starting to push the nerves. That's why I was getting so much pain. So there are lots of videos out there that will walk you through the process and show you the animated version, or you can watch the full surgery. And trust me, I did all of those. My husband and my family thinks that I'm really weird because I wanted to see what that was like. But again, after doing that and after seeing and understanding what was going to happen, I still wanted to feel like someone who had been through it. I wanted them to explain it. So that's so much why I wanted to do this video, because as much as I searched, I could not find anyone who looked like me, who had gone through this, who could say, sister friend, this is what it feels like. This is what you're going to go through. This is what the pain feels like. So hopefully I'll be able to help someone because of that. So anyway, he pretty much told me, here are your options. You can live with it and just deal with the pain because it's not going to go away. Yes, we could try shots, but those only last so long. Again, it's not going to go away. Or we could try surgery. If we try surgery, we'll try to fix it. It doesn't mean that it's going to be 100% guaranteed that you'll never feel this again, but that's an option. One of the reasons that I went to him and went to the doctor and tried to pursue this further was because I got to the point where not only was I having a lot of back pain, but the pain was literally going down my leg, my left leg, and I couldn't sit, I couldn't stand for more than half hour to an hour. You know, I was constantly rubbing it, trying to find some kind of relief, because again, it was a lot. You know, I had people tell me before that it was my sciatic nerve, and you know, everybody would say, oh yes, the sciatic nerves, those really hurt and they bother you in your legs. And so I knew all of this because again, I've Googled so much on these issues before. So when I was presented with the possibility of surgery as an option, I said, well, let me think about it. Went home, talked to my husband, talked to my family, and thought, okay, we're gonna go ahead and do this because it's been years to get some sense of relief. So the first process after that, like I said, I'd already done x-rays, already done the MRI, talked to the doctor, and so they scheduled it pretty quickly. From that doctor's appointment until the surgery was scheduled was maybe 3 weeks, and that's rough because this is all happening during this COVID-19 period. And so when it got scheduled, I kept thinking, oh my gosh, it's going to get canceled because infection rates in where I live here were going up, and everybody was just really concerned about hospital beds and ICU, and we just didn't really know. But somehow the surgery didn't get canceled, and I went through it. So once I got there, I checked in by myself. My husband dropped me off at the door because he couldn't come in. He couldn't even walk through the hospital doors with me, so I really had to do this all on my own. So I went in, got checked in. Several days before I got checked in, I had to go to the hospital, and they did a COVID test to make sure that I wasn't a carrier, or I wasn't sick with the disease right now, or the infection right now. And then I had to quarantine for 3 days before. So anyway, he dropped me off at the door, got checked in with one of the receptionists there, then was taken into the pre-op prep and got changed, talked to the doctors. All of the doctors who were involved came in and talked to me. My regular doctor, the anesthesiologist, the nurse who's going to be in with me during the procedure. You sign your life away basically with all sorts of paperwork, and it's really nerve-wracking, and it's really scary to be there on your own. So luckily I had my phone, and I could FaceTime with my husband and with my family just through the process. But it was a really difficult process to go through all by yourself. So once we got all checked in and went through the procedure, I remember at one point the anesthesiologist saying, "Okay, I'm going to give you some happy juice." And I had it in my mind that I was going to count down 5, 4, 3, 2, 1 and really know my surroundings. But no, I had no idea. When I fell asleep, all I knew is that at one point I woke up and I was in the recovery room with them shaking me, saying, Michelle, can you wake up?" And again, it was really strange to go through all of this and not have any loved ones around, not have any family members nearby. So I think the surgery was maybe 3 hours. I'm not really sure how long the surgery takes and then how long I was in recovery. But by the time they got me wheeled in into my room, I thought it had been a while, so I was able to talk with my family.
Hi everybody, just want you to know I'm doing better. The pain got progressively better throughout the night. The nurses here were great about making sure that I was comfortable after my TLIF surgery. So just wanted you to know that things are on the mend. Love you.